Our job is to support the people in healthcare, whether department, supply chain, CFO, whoever it is. That's our job. Our job is to support them for their success. Our job isn't to outshine. Our job isn't to make anybody look like they're not doing a good job. That is never the case. We are in the background. We are building up those who brought us in. We want to collaborate. We want to extend our knowledge. We want to help train. We want those people to get promotions, to see things in a different way. But this is all about helping, supporting, and being in the background. And the ones that we're working for, they are in the foreground. It's about them. We get the honor and the privilege to support them, to be on the business side of healthcare so they can be on the healthcare side, healing and saving lives.
Welcome to the Healthcare Leadership Experience, a place where healthcare leaders will share proven strategies and innovative approaches to leading the clinical and business side of healthcare. This show is sponsored by VIE Healthcare Consulting, who has proudly helped hospitals save over $700 million in non-labor costs since 1999. Here's your host, Lisa Miller, founder and CEO of VIE Healthcare.
Hi, this is Lisa Miller. Welcome to the Healthcare Leadership Experience. On today's episode, we are going to be discussing why engage a healthcare consulting firm. I'm joined with Lisa Larter, who is our producer. Welcome, Lisa. Looking forward to this discussion.
Yeah, me too. I can't wait to hear what you have to say on this.
And we have Rich Dormer, who's VIE's COO, and Bryan Covert, who's VIE's Managing Director, joining us today. All three of us, as well as the team at VIE, we work on cost savings initiatives and margin improvement initiatives throughout the U.S. So welcome, Bryan. Welcome, Rich.
Thank you for having us.
Great, thank you.
So we're going to jump right in. It's interesting because healthcare consulting firms have, I think, a good rap and a bad rap. So I think the good rap is that we're able to support a hospital's initiatives. We're able to provide expertise, specialization, rapid deployment, helping them fill a gap. There's all these reasons why it makes sense to bring a healthcare consulting firm into your organization. Is assessment, it's looking at competitive analysis. Maybe there's a position that needs to be filled and it's temporary to bring somebody, a group of people in. There's a merger and acquisition. There's all these reasons why you'd bring a healthcare consulting firm in. It makes really good sense. And the bad rap is sometimes the consulting firms give you big binders, talk to your employees, and then put those ideas in the binder. They don't implement. They take too long. They're not results focused. And so there's the bad side, right? So today we kind of want to talk about why you should bring in a healthcare consulting firm when it makes sense, and what things to look out for, how to approach some different scenarios, and just have a really good discussion. So Lisa, I don't know if you have any questions as we start this podcast.
No, I'm just curious. I mean, when I think about a healthcare consulting firm, the first thing that comes to my mind are the big guys. And I know there's a really big difference between the big guys and a small boutique consulting firm like yours. So I'd love to even hear a little bit from you on the competitive advantage that a smaller specialized firm can provide.
That is such a great question. And I will talk through that because it's something that we deal with as a small firm, and I've often had conversations with our clients about it. So, there's brand recognition. I think someone famously said, you'll never get fired for, if you bring McKinsey in, right? And so I think there's this brand recognition when it comes to the board or the C-suite, that they can't get in too much trouble if they're bringing in those big names, whether it's Accenture, Deloitte, whoever that may be, because that brand name kind of establishes, okay, well, they've known in the industry and I brought them in and they didn't do anything. So, or they did, or whatever the case may be. So, I did what everybody else is kind of doing. And listen, there's a lot of great consulting that's going on with the bigger firms. They're just different. And so what we hear from our clients is that, you're speaking to decision makers, myself, Rich, and those who are operational, who run the company, we're able to pivot. We're able to be flexible. And I think that's really important because, we're able to offer a customized approach. We won't have to say, let me go back and talk to a partner and wait 2 or 3 weeks. And here's the binder you've got to go through in this order. We're able to be more innovative. And I think that's the advantage. Plus, we're not a generalist company. We're highly specialized. We focus on margin improvement, and we have this incredible subspecialty around non-labor costs. And so because we have this expertise, a lot of those companies have come to us to kind of help them, which is kind of interesting over the years. And Can I
stop you for 1 second?
Yeah.
Are you saying the big guys actually outsource to specialized firms like yours because they don't have enough of the in-depth expertise?
Yes, that happens more than most people realize.
Wow. And so essentially a hospital you just talked about planning your 2020 cost savings pipeline in your last episode. So if a hospital is really looking at managing costs, they need to be cognizant that if a bigger firm is outsourcing to a smaller firm like yours, they're marking those costs up.
Absolutely. And they're only marking their costs up, which is a great point. They're bringing in a generalist. And usually the generalists are kind of piecemealing different aspects together of a really large project. And we've had some situations where the hospital has found out that we're the cost experts. And, we have gone through initiatives quickly and effectively, and they've been thrilled. And they've said, why didn't we hire you? Why did we hire XYZ? And that speaks to the fact that they have brand awareness, whether they have more marketing or they're embedded in the hospital in some way, shape, another, like GPOs are, very much embedded in the hospital. So, we really have to get that word out. Us as this cost specialized firm that goes deeper than any other firm, but there are other companies. There's companies that are phenomenal at strategy that are not McKinsey. They're small boutique companies. They've had their own IP and formulas and methods. They're easier to work with, and I think that hospitals really should, kind of take more of a look at those smaller boutique companies. I find it concerning sometimes when the GPOs really are forcing all of the services to go through them. I had a CFO once tell me, Lisa, I wonder how much innovation we lose or how much we don't get from outside companies because we're buying everything through our GPO. Now I didn't say that, that was a CFO that said that, because so many of some of their services and, whether it was analytics, consulting on the revenue cycle side, and it's expanded, kept on coming through their GPO. She was wondering how much innovation or how much that they didn't get because they didn't go to the marketplace. And you've got some of these phenomenal boutique consulting firms that offer highly specialized services.
So it sounds to me like if you're looking for generalized support, then you're going to pay more for it. But the more specific you are on what you actually know you need in terms of your cost saving strategy, the more specialized of a consulting firm you can get to help you reach those goals.
Yeah, absolutely. And whatever you're looking for, whether you're looking for expertise for specific IT integration, whether you're looking for revenue cycle consulting, I think that, you want the Ferrari, you want the best. If you have an issue, a health issue, your GP is only going to get you so far, but it's that specialist that you want. It's the second opinion and the specialist that takes you, where you need to get to. So, Bryan, I got a couple of questions for you. So in your experience, what should a hospital expect their healthcare consulting firm to do? What are your thoughts?
Well, first of all, they should expect them to deliver cost savings, achieve and deliver actual cost savings. They should be getting perspective on what other successful organizations are doing, how they're accomplishing their goals. The consulting company should be identifying cost savings initiatives and opportunities that the team hasn't considered yet, bringing new things to the table. One of the most important things that personally I just think too is that when you're working with a consulting company, they should be taking work off the plate of your team. They shouldn't be
It's a great point.
bearing your team with demands for information, for reports, assigning them more tasks in their daily work. They should be taking work off of their plate and helping you achieve more. And that's really a mark of like a successful engagement to me.
Yeah, it's a great point. It's funny because sometimes we've seen the data requests from other firms, and I look at the data requests, I'm like, wow, that's going to take like 3 people to do on the hospital side. Like they just don't make it easy to work with them. That's why we always say, we're going to make it easy to work with you. You know, we build our entire model around, let's make it easy to do business with each other and take work off. It's a great point, Bryan. Thank you. Rich, how about you? So, what kind of outcomes should hospitals expect?
The biggest thing I see is that in my mind, there's 3 levels of consultants. So to get the outcome, you have to know what you want. So first and foremost, what's your problem? So the first level of consulting is, I have a problem. I know specifically what the problem is, and I need to go find somebody. So this is, let's say, an RFP for food and nutrition services or an OR assessment. This is a very commoditized space. So you go out, you get resumes, you get the proposals, and then you pick the best one. Then you have a second layer of consultant. Now, this is a little bit more challenging. This is where you start to get in some of the bigger companies, and we do all this as well. It's identifying opportunities. So this is where that second layer of consultants are. And, there's less of these than there are of those general consultants for specific problems. But this is where, Lisa said, a lot of times you'll get a big binder, right? So you'll have data, it'll give you direction, you can use it for your team, but really what's the value? I mean, sometimes the value is good, sometimes it's not, right? So that goes to this third level, the top of the pyramid consultants, which is, again, there's a problem. I don't know what the problem is. I just need to identify it. But you might not have the team or the resources or the expertise to implement. And I think that's the biggest area that when you're looking for a consultant, you have to understand, am I getting something? I just need one specific problem. Do I just need to find some opportunities for my team? Or do I need to find some opportunities as well as get some implementation? Because, that top layer is where the biggest opportunities lie, right? We talk about the highly specialized expertise. Implementation is the hardest part. Everyone can come in and say, hey, you can get 10% off this, but then they say, okay, do it for me. And most groups can't do it.
I think it's a great point. Not only can most groups can't do it, that, even sometimes because hospitals sometimes don't want consultants, they want a benchmarking resource or they want a tool. And then the tool says something, then it can't be done. And, it's easy to put numbers in a dashboard or in a report and kind of say, this is what needs to be done versus getting it done. I mean, that's a big difference, whether it's cost savings, revenue improvements, anything. Implementation is the hardest part. The binder is the easiest.
Right. So let's say we're working with a client and they say, oh, we just need an assessment. So we get brought in by clients and they say, or here, we need a purchase services assessment or PPI assessment. And we'll come in and we'll find opportunities for them. And then we'll give them, the report, and then we'll support anything they need, any background. But that information that we provide them would be the same exact that we would use in this top layer, which is negotiation. So we're not going to give our clients anything that we wouldn't sit in front of somebody in hand, because everyone's been in the situation where, there's a benchmark out there. No one knows where it came from. Then you go to the vendor and they basically laugh at you because no one in the world even has that. It was like a mistake in the data. So we don't do that. We look at what we've accomplished. We know where the market is, and we'll put those reports together. So when you go to negotiate, you have the knowledge that, this is supportable. And then you turn to us and say, we need you to do it. We would use the same exact information.
So can I just talk to you about that in a moment? I like this conversation because we sat on it was a publicly available webinar with a couple of our competitors. And actually 3 of us were watching the webinar, and one of the people leading were talking about a purchase services benchmarking, and they were graphing out coding, and they graphed out coding to a higher dollar and a lower dollar value that they identified in a hospital spend. And this person was showing that the higher dollar was undisciplined spend. And because they showed the price point, I remember clearly Bryan goes, that's not undisciplined spend. That's because they're insourcing and outsourcing. Can you talk about that for a minute?
Yeah, I mean, this company clearly had a great tool to aggregate and to visualize and look at this data. But what they were missing was just an understanding of the context of that data. Because if you've negotiated agreements for coding, you know that there's distinct markets. There's onshore versus offshore. So you're hiring somebody who's based in USA, a company, they're working the same hours as you. There's no language barrier. They understand the US healthcare market. It's one rate. And if you're hiring somebody from another country, we see these companies that are based in Ireland, that's a different rate, or a company that's based in India or even another country, it's a much lower rate. So what they were actually looking at was the just two distinct market rates that exist for onshore and offshore coding, but they weren't interpreting it that way. They were interpreting it as a pricing opportunity or
and
undisciplined pricing.
Undisciplined pricing is what they identified, right? Pricing opportunity.
And recent example, we're working with a large health system, and within the health system, they had one provider for sleep studies. So when we were looking at the data, we looked at it and said, what's their current rate at one location, and why is this other location $200 less per multi-level sleep study? You know, and if you don't have the expertise in the background of reviewing these contracts, you wouldn't ask that question. You'd be like, oh, look, this is a better price point. Let's just go to the best pricing, and that's our benchmark. But there was some questions around it. We kept asking questions. And finally, even though the contract didn't state it, when we finally got to the end user to go through it, she said, well, that's because we use our own staff. So there was a secondary rate that was not part of the rest of the health system because that location used their own staff, therefore was less expensive. But if you're just looking at the data and you don't understand what the data is telling you, or you don't question where some of this might be a problem, then that's where it leads to the binder showing a $200,000 opportunity because of this one price point. Yet at the end of the day, it's probably more like a $10,000 opportunity.
Yeah, we see a lot of that. And I think ultimately that's the frustration, I think, around bringing in a consulting firm, because I think there have been assumptions, or some people have been made to, maybe not look good, or there have been bad recommendations. And now someone in supply chain or department has to go to the CFO and say, no, that's actually not right. Both cases that Rich and Bryan talked about, we have two different ways that we approach these situations for coding. And like Rich mentioned as well, for sleep studies.
One other piece to your question, as far as trying to understand what expertise you want to be looking for, again, depending on what your needs are. Right. But if you're looking at really from a proposal or just presentation, understanding where the consulting firm's former current client list, explanation of the services, actual examples, you want to see that they've had the ability to do these things, to not only, say it, but also show the examples. They have multiple examples from different classes, from clinical purchase services to support service, finance, IT, HR, administration.
Right, because you don't want to bring in 6 different companies to deal with the purchase services. You'd like to bring in one, doesn't miss anything. They're not looking at the same things.
Right. And it's important to understand their processes. How they get to this? What systems are they using? Like Bryan mentioned before, what resources is going to take on, your end when you're evaluating these consulting firms, right? And then how are they successful in a similar situation? Is it one specific project? Is it, again, working with multiple and trying to identify and then implement, and really what a big piece is, who are their people? Like, who's going to be your account? I mean, we've had a lot of situations where you have someone that this is the front person for sales and marketing, and then all of a sudden this whole other group comes in and you had no relationship with. So who's going to be the person that, who's going to be the front of the organization? Who's going to be the one that you can call, at 6:00 at night to say, I have a problem, right? Or 7 a.m. on a Tuesday, like, I got a problem. Right. So these are the ones you have to understand, like, is it going to be a big corporate one where they have a structure and you have to follow that structure, or these more boutique companies that are nimble, that customizable, that are flexible to clients' needs?
Yeah, I agree. Bryan, what red flags should people look out for?
I think we talked a lot today about getting results and achieving results. And I think initially one huge red flag would be that when you're contracting, you're hiring a consulting company, that they're not aligning themselves strategically and financially with the client. So the client's success should be the consulting company's success. And when we talk about that, we talk about, again, we mentioned companies that hand over the binder, companies that use technology or a tool to support their consulting activities, categorization. These are all fantastic tools, but how do they bridge that gap from the binder, from the categorization to developing real initiatives, to achieving real results? And then how are you holding them accountable to that so that you're both succeeding?
Yeah, and I love that. And, the other feedback we get is we're collaborative and we train. So our job is to support the people in healthcare, whether department, supply chain, CFO, whoever it is. That's our job. Our job is to support them for their success. Our job isn't to outshine. Our job isn't to make anybody look like they're not doing a good job. That is never the case. We are in the background. We are building up those who brought us in. We want to collaborate. We want to extend our knowledge. We want to help train. We want those people to get promotions, to see things in a different way. But this is all about helping, supporting, and being in the background. And the ones that we're working for, they are in the foreground. It's about them. We get the honor and the privilege to support them, to be on the business side of healthcare so they can be on the healthcare side, healing and saving lives. And we're in the background. I think that's really important too. Lisa, do you have any other questions or thoughts?
No, I think that everything that you guys have talked about is really great. I'd love for you to maybe wrap it up with the 3 things that you believe a consulting firm like VIE Healthcare can really do for hospitals when they engage a specialized firm.
Yeah, absolutely, Lisa. So there's 3 observable key client outcomes. And this is for anybody, and on this podcast today, we kind of went in and out of, what we do, also, broadly, what you can look for other firms or other initiatives you need. But in the broad sense, there are 3 key client outcomes. Number 1, they have to give you financial clarity. And that maybe is not always financial clarity. It could be, clarity around the initiative, but for the purpose of margin improvement, it's about giving financial clarity. How can we be sure we're uncovering all the margin improvement opportunities available to us? In the broader context, how are we sure that we are approaching this initiative from all different angles? We want to make sure we're not missing out on anything. So it's clarity. It's the initiative clarity. In our context, it's financial clarity. Number 2 is disciplined performance. How can we be confident about the decisions and execution on financial management across the organization? So whatever performance you're looking to achieve, it could be a merger and acquisition, it could be a new technology. You want disciplined performance, and that healthcare consulting firm should be able to bring that as a key outcome. And number 3, exceptional results. How will I know that we're getting there? Well, you always know that you're getting exceptional results because you're getting above market outcomes. You can get average outcomes or above market outcomes. But again, there's 3 things a firm like VIE can do for hospitals. 1, give you financial clarity. 2, disciplined performance. And number 3, exceptional results. And in that context, you should be able to use those 3 to model whatever consulting firm that you're bringing in. Hold them to metrics, hold them to milestones. I'm a big believer in aligning performance and having a performance-based milestones. But I think those 3 areas are really important, Lisa, and that can be used in any context.
Awesome. Thanks, Lisa.
So I welcome you to listen to our previous episode about creating a cost savings pipeline in 2022. That's episode number 20. And our next episode, which I am really excited about, is episode 22. It's out negotiate your vendors. I think a big topic because negotiation is tied to financial improvement. So Lisa, thank you for being on the show today, Bryan and Rich, and everyone for listening. If you have any questions or if you have suggestions on shows, we'd love to get those suggestions and add that to future podcasts. Thank you, everyone.
Hi, this is Leah. You are listening to my mom's podcast, The Healthcare Leadership Experience.
Hi, this is Fernando. If you would like to speak with my mom, just email her.